Hi. As you know, I've been really sick and my life in the last 5 weeks has been tumultuous. I've never been in that much pain before, and it was enough pain to ready my mind for even death. I was fighting a staph infection in the blood, yet my immune system was completely zapped because I had almost zero white blood cell and neutrophil count. The doctors knew this was serious. It was a risk for me to be admitted to the hospital with no immune system, as the hospital is infested with so many germs from sick patients. But they couldn't send me home because I had a staph infection that was not responding to any antibiotics. Then my body began to respond to the fifth antibiotic that they put me on. It's called cefazolin, delivered via the PICC line, peripheral inserted central catheter, and I was to be on this antibiotic every 8 hours, 3 times a day for 4 weeks. The hardest part was not knowing what was happening to my body. While waiting for the results of the bone marrow biopsy, my mind was full of fear about leukemia, lymphoma, and aplastic anemia, which are all serious conditions that would alter my life as I knew it. And my mind didn't absorb all that was happening. In truth, it's still not done processing everything. I was discharged from the hospital on May 24th of 2019 after 9 days of hospital stay. My bone marrow is recuperating fast, and it's the best case scenario. My bone marrow was reacting to Plaquenil, and after 19 years of taking this harmless medication that we know of, on and off, it had finally shut my bone marrow off. As soon as my new rheumatologist removed the Plaquenil from my regimen, my immune system began to recover. And my new rheumatologist called me yesterday to let me know that my labs from Monday, June 3rd of 2019, showed almost normal white and neutrophil count with no lupus flare based on my serology. So this is great news. I then reviewed my labs on May 8th of 2019 when my old rheumatologist dismissed my labs and I was having a minor lupus flare. That's all he told me, and sent me home with a tapering dose of prednisone. I remember being so sick in his office trying to show him my rash and tell him how awful I felt. I told him it didn't feel like it was a normal lupus flare. He was in a rush and was anxious to get me out of his office. The labs in April of this year also showed declining white blood cells, neutrophils, and fast declining platelets, which is all collectively called pancytopenia. He assured me I was in a flare and to make sure to take my Plaquenil and to be diligent about my Benlysta injections. Then finally, on May 15th, when my fever kept spiking even with a week's worth of prednisone tapering dose, he encouraged me to go to the hospital. This was when they found that my bone marrow was wiped out and my neutrophil and white blood count was non-existent. When I was hospitalized, I met the new rheumatologist who researched and suspected Plaquenil to be the root cause. He's the one who removed Plaquenil from my daily regimen, and that's when my white blood count slowly began to rise. I was discharged on May 24th, 2019 on Friday before Memorial Day weekend. I then was able to work 3 full work days that week seeing my patients and then go off to Asheville for advanced training in Ayurvedic medicine. My labs continue to improve, but I have 1 more week of antibiotic therapy through my PICC line. You can't see through my jacket. My PICC line will be removed June 12th of 2019, which is next Wednesday, and I can resume my normal life without the PICC line. Thank goodness. And I'm so thankful for my recovery, and I hope to share more inspirations with you regarding this episode. In retrospect, though, there's so much to be gained from my experience. I know I was stressed to the max and work-life balance prior to the episode, and I can't tell you how much we all take health for granted, especially I did. I thank you for being on this journey with me, and I will be sharing more concrete research on the implications of pancytopenia and Plaquenil. While lupus was the suspect for all my ailments, it turned out it wasn't lupus at all from beginning to end. The take-home lesson is to always trust your instinct, and when in doubt, speak up and seek a second, third, or fourth opinion. No one doctor can possibly know the nuances of what you may be experiencing. Lupus is bizarre, and due to the physiological changes and the effect of the meds that I've been on for almost 19 years, I feel it's in our best interest to be proactive about our health. Thank you so much for all your encouragements, and I will see you next week. Please subscribe to our newsletter on lupusrebel.com and our YouTube channel, Dr. Connie. Also, follow us on social media at Lupus Rebel on Facebook, Instagram, and also Pinterest. Thank you, and I'll talk to you soon.